Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wiening.
Okay, today I want to make a video here about a question I get all the time, or not even a question. I hear people make this mistake when I'm taking a history.
Yeah.
It is the difference between osteoporosis and osteoarthritis.
I got some osteoporosis in my knee, doc.
That's it. That's the thing. I get that, or I'm taking history. Yeah, I got my knee hurts because of my terrible osteoporosis.
Which probably is not true. You may actually have osteoporosis, but it probably is not the cause of your knee pain.
No, it's like comparing apples and oranges.
Okay.
Although you can compare apples and oranges.
Sure.
Do you like apples better or oranges better?
It depends. I like a really good orange and a firm apple. I don't like soft apples.
But if you had to pick?
I think apple.
Yeah, I eat a lot more apples, but I think deep down I like oranges
They
better.
travel better. You don't have to peel them.
Yeah, it's true. It's easier. It's easier. But in any case, osteoporosis and osteoarthritis are two completely different processes.
Often occurring concurrently, but yes, very different.
Often they happen. You have them both, that's fine, but it's important to understand which one is causing which issue for you medically.
Okay, so let's talk about osteoporosis first.
Okay, osteoporosis is a measurement of your bone density, which then is a predictor for how easily you could fracture a bone.
Okay, so it actually means porous bone.
Yeah, porous bone or low bone mineral density.
Yes.
And the implication of that, or the problem with that, is that it means you're at risk for fracturing a bone easily. Now, when a bone fractures too easily, let's say you have a fracture but it broke under what we call physiologic loads, or
like standing here.
Yeah, standing, sneezing, or a fall from a low height and you break something. It's usually your wrist, hip, or a lumbar spine. Those are the three sort of most common osteoporotic fractures. It's called a pathologic fracture.
Right.
Okay.
And that's actually part of the criteria often for your diagnosis, other than the bone mineral density.
Yes, exactly. That there's the bone mineral density. If you've had a history of fractures, and there's a questionnaire that's often given that helps determine if someone has osteoporosis.
But if a 30-year-old guy comes in after hella skiing and he breaks his tibia and is like, "Doc, do I have osteoporosis?"
Yes. Unlikely.
Probably not. Not for sure. You don't know. But probably not.
That's definitely not a defining cause. So if you had a significant trauma and you broke something, you probably don't have osteoporosis.
Right.
But if you had a minor trauma or a physiologic event and you broke wrist, hip, lumbar spine, like a vertebrae compression fracture, then you probably have osteoporosis.
I have parents ask me that all the time. My kid broke his clavicle and his wrist and it's escaping. I'm like, your kid's this crazy kid who likes to be active and do crazy stuff, right?
Your kid's not crazy.
No, not crazy. Do crazy stuff, like
they do crazy
wild stuff.
Active kids, and that's fine, right? Kids are active, and
they're like, no, your bones are good.
So that's osteoporosis.
Yes.
Okay, anything else to say about osteoporosis? We'll do another video only on osteoporosis, but for the purposes of this video, we want you to know enough so you can compare the two.
So for our patients, how do they get diagnosed? They go to their family doctor. They have a history that is consistent with potential osteoporosis, and then you have to have a bone density.
Yeah, you'll get a questionnaire that'll answer a bunch of questions, that asks you a bunch of questions about your family history and all that stuff. And then using all those, they all get scored: the questionnaire, the history, and your bone mineral density test, DEXA scan. Then you get the diagnosis of osteoporosis.
Okay.
Does it hurt?
Osteoporosis?
Yeah.
So I'd say in general, no, but if you have a fracture from osteoporosis, that hurts. But just walking around with osteoporosis typically does not. Some people would describe achy bones potentially. But we don't know. It's hard to quantify. But it shouldn't hurt.
Generally, osteoporosis is asymptomatic.
Yes.
Kind of like hypertension, high blood pressure. Right? You don't feel it.
Yes.
But it has some serious health implications.
And I would say, like hypertension, you don't know you have it until you break it. Just like hypertension, a lot of people don't know they have it until they have their blood pressure checked, and someone says, "Hey, did you know your blood pressure is 200 on 130?"
You're like, get on treatment, right?
Yeah.
So osteoporosis, usually asymptomatic. You don't know you have it, but puts you at risk for fracture.
Okay, what if I have the osteoarthritis?
Okay, you got a touch of the osteoarthritis now.
Yes.
That is different. Osteoarthritis affects your joints, okay? Where two bones meet and make a joint, that's where osteoarthritis affects.
Can I have arthritis of my tibia?
No.
Of my femur or of my forearm?
No.
Because it's not a joint.
It's got to be in a joint, right? Okay. And that is it's inflammation in the joint.
Right.
And generally is symptomatic as it progresses.
Agreed. And we don't really know the cause.
No.
It's idiopathic. It happens for lots of different reasons. There's lots of different kinds, but osteoarthritis itself, we don't really know the cause.
Sometimes you know the cause. Sometimes you do. So if you had a post-traumatic osteoarthritis, if you had a fracture in a joint, that could
I refer to that as post-traumatic arthritis, though. I guess theoretically it's post-traumatic osteoarthritis, but yeah.
Right. You could have if you had an infection in your joint, that could lead to arthritis in your joint down the road.
Yes.
And there are other sort of hereditary conditions that can lead to
arthritis. Yes.
Okay. Of course, there's inflammatory arthritis, like a rheumatoid arthritis or a psoriatic arthritis. That'll be another video, okay?
Yeah.
Okay, because people don't generally get that confused with osteoporosis. I think osteoporosis, osteoarthritis gets confusing because the majority of the word is the same.
Yes, agreed, the osteo part.
Yeah.
And back to the osteoporosis part, because osteoarthritis, we've talked lots and we have tons of videos on the types of treatments up to and including surgery. Is there a treatment for osteoporosis? And we could obviously do a whole video on this, but...
Yeah. The treatment for osteoporosis is way different than the treatment for osteoarthritis.
Right.
The treatment for osteoporosis is aimed at reducing your risk of fracture.
Right.
So, and it's often a medication-based or a dietary supplement-based.
Strength and weight-bearing exercise.
Yeah, man, like everything, like almost
Always
everything, exercise
and
diet really help.
Yes.
There's like first-line treatment for just about everything we deal with.
Yeah.
But yeah, weight-bearing exercises, and their diet, vitamin D we've talked about on other videos as well, and there are
some prescription
medications in various forms, injections versus pills and whatnot, and all of them have sort of risks and side effects.
We will do a follow-up with like an osteoporosis expert.
We will get an osteoporosis expert. We deal with the sequelae of osteoporosis a lot, right? Because that's why our fracture clinics are so busy. That's why we're coming in.
Fractured hip. Typically, like the grandma with the fractured hip, osteoporosis.
Yeah, exactly. So, but for people who treat, I don't per se in my practice treat osteoporosis, make recommendations, but generally there are specialists that do treat osteoporosis.
Yep.
So we will get one of those specialists on to discuss those. So that's it. That's osteoporosis, osteoarthritis. Apples, oranges.
Yep.
They're completely different.
But you have both.
You can have them both in a fruit salad, for example. But they are just two different things, and it's important to understand, for your own health, when you're discussing your issues with your medical practitioner, you want to know what you have. Do you have osteoporosis? Do you have osteoarthritis? Do you have both? And what's causing your symptoms? And you'll know why you're taking certain medications.
It's good. If you like this video, please like it. Subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.